Hello and welcome to BBC World News. Let's return to that breaking news from Brazil. The President, Jair Bolsonaro, says that he has tested positive for coronavirus. He says he began feeling unwell on Sunday, had a fever and was suffering some pain. He then took a test and that was confirmed positive. Mr. Bolsonaro has long played down the danger of COVID-19, saying it's like a little flu. His country is the epicenter of the pandemic in Latin America, with more than 1.6 million infections. Well, just a few minutes ago, the World Health Organization's Executive Director, Mike Ryan, has been speaking about Brazil and the President.
The virus doesn't really know who we are, whether we're prince or pauper. We're equally vulnerable. And I think what it really highlights is our collective vulnerability to this disease. So we wish Mr. Bolsonaro and his family the best in this regard. It is a time in any Brazil is a great nation that faces a difficult task and a difficult time.
Well, let's go straight back to our correspondent in Sao Paulo, Camilla Motta, covering this story for us. And Camilla, I know it's only recently broken, but the immediate reaction where you are?
Well, some people actually were shocked that it took so long for Mr. Bolsonaro to get infected, since he's been not following the social distancing guidelines. He usually goes out on weekends to greet his supporters, and it's really hard to see him wearing a mask. So sometimes some people were shocked that it took so long for him to actually get infected.
Just take us through the details that we learned, because we're looking at pictures. He gave a pretty extensive, long interview in Brasilia, giving the details, telling us that he was taking that controversial drug as a treatment, and then he concluded that interview by taking the mask off and continuing to talk to reporters, even though he's tested positive.
Yes, just a few minutes ago, Bolsonaro was talking to reporters in front of the presidential palace, and that's when he said that he started experiencing the symptoms on Sunday, and that right away he started to take hydroxychloroquine, this drug used to treat patients with malaria, a really controversial subject here in Brazil, because there's no hard evidence that hydroxychloroquine actually works for COVID-19 patients. But Mr. Bolsonaro is a really big enthusiast of hydroxychloroquine, as Mr. Donald Trump also is.
And of course, as Brazil and the president has pushed to open up, we've seen just a huge number of confirmed cases as the backdrop. Where is the Brazilian public in all of this?
Well, Brazilians have been in favor of social distancing and quarantine measures since the beginning. That's what the polls have been showing. But it's been almost 4 months now that some cities have been in quarantine. So some people say that was about time for some cities to reopen, because the economic toll was starting to become unbearable for some families.
Camilla, thanks very much for the latest from there. Let's continue, though, with this. Let's speak to Professor Anthony Pereira. He's the director of the Brazil Institute at King's College London. And what is your take? Was this pretty much inevitable, do you think?
It was likely, given President Bolsonaro's personal behavior. But I think it's going to raise some interesting questions, perhaps some awkward questions, about the president's behavior, his approach to coronavirus, but also his foreign policy. So as your correspondent said, he's been going around Brasilia without a mask, greeting supporters. So, he was risking contracting coronavirus. Looks like now he has. I think it'll also, you see a lot of the playbook of Donald Trump in the president's actions. He's been criticizing the governors over lockdown. He's been promoting hydrochloroquine and so on. And people will be wondering whether easing out of lockdown while cases are going up is really the right strategy. And then there's evidence, although we don't have direct evidence of this, but there's suggestions that he may have contracted this coronavirus at a July 4th event at the residence of the U.S. ambassador. Certainly there are pictures from that event where people are not social distancing and they're not wearing masks. And that would just sort of reinforce these questions about whether the kind of lockstep that the Bolsonaro government is in with the Trump administration is really the best foreign policy for Brazil.
And just to remind any viewers watching who may not be familiar with every twist and turn when it comes to Brazil and Bolsonaro, at pretty much every stage of this pandemic, he's been resistant, hasn't he, to the conventional opinion, to medical opinion, to scientific opinion, downplaying the risk, describing it as flu, as I said there in the introduction, going against governors, firing health ministers.
Yes, he's gone through two health ministers. So he fired Luis Mandetta in April. Taish he undermined, and Taish resigned in May. And now he's got an interim health minister who's a general who's doesn't have medical qualifications. And I think, unlike a lot of leaders, we saw at the beginning of the coronavirus pandemic a lot of governments taking positions which they later regretted. So in this country, people were talking about herd immunity and not locking down. The Trump administration changed tack. But the thing is, a lot of those leaders did change when they got evidence and when they were pushed by public health experts. Bolsonaro has been one of the few leaders that really hasn't budged. He's really doubled down on his initial position, which was that it's not very serious and that people have to just carry on, have to go out to work, and that if you lock down, if you have strict quarantine measures, you're letting the coronavirus defeat you in a way.
And yet you now have a backdrop of 1.6 million confirmed cases in that country, and that's only confirmed cases. The best bet is it's significantly higher than that, which brings me to the final point, which is, at what point does it come, or does it not come, do you think, that fundamentally there's any sort of thought about a change of strategy? The World Health Organization saying only the last hour or so, this is a pandemic of staggering proportions, and they're most worried about Latin America.
The concern is well placed. I think the good thing for Brazil is that it is a federal system, and the Supreme Court in April upheld the principle that mayors and governors have authority with public health matters. There's good capacity in terms of medical research and public health expertise in Brazil, and where there are surges and where there are problems, local officials have the authority, despite what the president's doing, to reimpose lockdowns or to suggest new patterns of behavior. So I don't think the situation is as dire as one might think from looking at the actions of the president himself. But what's been lacking in Brazil is central coordination, information, getting people to coalesce, deciding on a strategy together. That's been missing, and probably will remain a missing piece of the jigsaw puzzle in Brazil, even though the president now appears to have coronavirus.
I suppose in that sense, it's another parallel with the US, with the states enabled to do different to what the White House and the federal administration is actually doing. We'll leave it there. Yes. Anthony Pereira, thank you so much for that insight and that analysis. Thanks for joining us.
Thank you.